It's X1071 with Raven Lene and Love Me Not. Morning, you got me, Dave, on for your Monday. Sam Smith coming up and Lady Gaga in a second. First, they've got a couple of guests from Doctors Hospital. We've got Dr. Natalie Sharpe, who's a medical oncologist, and Dr. Pekko, who's an orthopaedic surgeon. How are you both? Are you well?
Great, thanks. Thanks for having us.
Very good. Well, obviously, I see Dr. Pekko on the regular because I have been talking about my hand on the show for the last 2 months. And Dr. Pekko was the guy that did it for me. So thank you very much for fixing me. I appreciate that.
Thank you. Speedy recovery.
Yeah, no, it's all good. So today, we're in to talk about joint and bone health. So is this something that you're kind of really pushing at the moment, or how's this come around?
Well, in terms of... So, you know that every month there's a specific cancer that people pay attention to.
Yeah.
So this month, August, is bone cancer. August? Sorry, July. Sorry.
Listen, it's early.
Yes.
We're all in the same boat.
Yeah.
All in the same boat, yeah.
Okay, yeah. So this month is actually bone cancer and sarcoma month. And so it's something that we pay attention to in this month. They're very rare cancers, but it definitely is something that we should be talking about and thinking about. And just bone health in general is important.
And when it comes to bone cancers, is there any signs we should be looking for?
So generally, these cancers tend to present with just bone pain, which is kind of like a deep gnawing kind of pain that people describe. For bone cancers that start in the bone, they generally tend to be in younger patients, like our teenagers and young adult population. And these people tend to get cancer that starts in the bones. In an older person, it's generally cancer that's spread from somewhere else that's gone into the bones.
Okay.
And so, you'll see different things, like you'll see weight loss of appetite, just generally not feeling well. Those are the kind of things, along with a pain that doesn't go away, that would say, okay, let's go get this checked out. So
I actually have actual questions from real people regarding their bone health. So I'm going to fire them at you and see what you both say. We're not saying who they're from, but these are legitimate questions. I had an ankle injury a few years ago, and I still limp a lot. I recently travelled and did a lot of walking on hills, and now my knees are still sore weeks later. I'm not currently exercising, but I want to get back to moving about without pain. What could be causing this lingering pain, and how can I safely start getting active again? I love this. This is like a talk show. I'm into this now. So what will we say to that person?
Very good question. Of course, it's a bit concerning if you still have pain in the ankle a couple of years later after the injury. So I think it should be rechecked and assessed whether the injury involves bone, the joint cartilage, tendons, ligaments around the ankle, or if it's something else. Because usually normal ankle injuries tend to heal in a couple of weeks and you are back on track. So having issues 2 years later is something that really should be looked into. Because, limping for lengthy time impairs the gait and can affect your other joints as well. So yeah, please come and have it checked. We have great radiology department that can assist in getting detailed information about the affected area.
Another one that has come in here. When should someone be concerned about bone pain or changes in their body? How important is early detection when it comes to rare cancers?
So, as with any cancer, early detection is very important because that gives us the best chance of getting rid of the cancer and getting to a cure. So, as I mentioned before, just always trust your instincts. If your body will tell you if something's wrong usually, and I know a lot of us have very busy schedules. We don't have time to get to the doctor. We just keep putting off making that appointment. But if there's something that's really lingering, and as Dr. Pekko said, certain injuries should recover and heal pretty quickly, and you shouldn't still be having pain, months, weeks later. So definitely, if something's lingering, something doesn't feel right, just go get it checked out.
I think the next sort of question would be, if people listen to this and they've got something they're not happy about, Dr. Pekko, what's their first port of call? How do they make contact with the hospital? How does it work?
Well, we have a great website, mydoctors.ky, that you can find the correct physician for yourself and make the booking online, or otherwise you can call us.
Yeah.
I was trying to remember the number. I love this bit.
Yeah. I never know.
Yes.
Anyone?
Yes.
Anyone? Come on, someone must know what it is. It's at the bottom of the sheet. I know what it is. That's my Sorry. I'll tell you what you should do, Dr. Pekko. You should call this number. It's 325 9000. There we go.
325 9000.
There we go.
Yeah.
Well, listen, thank you both of you for coming in. We really do appreciate it. And I hope someone has listened to this and it sparks something in them. And hopefully we can do our best to help them. So thanks for coming in. And we'll see you again soon. I'll probably see you next week with my hand. So see you later.
Thank you
All
for
right,
having
thanks,
us.
Dave. Bye.